Everyone knows that flying can be tiring, leave you with jet lag, feeling dehydrated, but how do you look after your health and stay safe when you're flying? In this video, I'm going to cover what you need to know. My name is Dr. Anne, and let's get started. What are the health implications of flying? Flying can have health implications, but for most people, these are short-term and temporary. These effects can include dehydration, discomfort around your ears, stiffness, aches and pains, and jet lag. Most of these can be managed by simple measures like staying hydrated, methods to help equalize ear pressure like chewing gum or swallowing, adjusting your sleep schedule for jet lag, moving around the cabin as often as possible for aches and pains, and avoiding excess fizzy drinks or caffeine to minimize bloating. But let me go through these in more detail to give you all the need-to-know facts. Bloating. Bloating during flights can occur due to a variety of factors, some factors including cabin pressure. This is when the air pressure inside the cabin and aircraft is typically lower than the pressure at ground level. This reduced cabin pressure can cause gases within our bodies to expand, leading to bloating and discomfort. This is similar to when you see one of your packets of crisps or chips puff out during a flight. Dehydration. The low humidity levels in an airplane can cause dehydration, which may slow down digestion and result in bloating. Reduced motility. Sitting in a cramped space for an extended period of time can make it difficult for your digestive system. This is because the limited movement and decreased physical activity can make your digestive tract more sluggish. Dietary factors. Certain foods and beverages can contribute to bloating. Consuming carbonated drinks, high sodium foods, fatty foods, foods known to create gas can all make you feel more bloated. To minimize bloating on flights, I have some simple steps you can take. Number 1, stay hydrated. Drink plenty of water before and after flights to stay hydrated and promote digestion. Number 2, avoid carbonated drinks and gas-inducing foods. Opt for non-carbonated beverages and avoid fizzy drinks where possible. Number 3, move and stretch around. Take short walks and perform stretching exercises while you're seated to help improve blood circulation and aid digestion. Number 4, wear comfortable clothes. Choose loose-fitting clothes and breathable clothing to allow for more comfort and less pressure on your abdomen. The second condition we're going to talk about is ear pressure. Some people get really bad ear pressure during takeoff and landing. So what can you do to help these symptoms? Well, this is caused by air pressure that's rapidly changing during takeoff and landing, and that's because air is moving from your middle ear outwards and inwards to help equalize and maintain your balance. During a flight, the air behind your ear is trying to come out via one of your tubes called. This tube connects your ear with the back of your nose. So if you're trying to support your system, one way is to pinch your nose and start to swallow, or to chew gum, and this will help equalize pressure. And as your plane is descending, another way of helping improve the pressure in your sinuses is to hold your nose and blow out. Do this gently and keep repeating this at intervals. Some people need additional support, and this might involve using a nasal decongestion or an oral decongestion from the pharmacy. So in summary, simple ways to help your ears equalize pressure is swallowing, yawning, chewing gum, and when the plane is ascending, hold your nose and start to swallow. If you're not moving, this can reduce blood flow, especially in your legs, which may increase the risk of developing blood clots, known as deep vein thrombosis. This blood in your calves can clot together and form a deep vein thrombosis. When this clot breaks off and travels around your body, it can get lodged somewhere it's not supposed to, and we call this an embolism. This can be life-threatening if it lodges in places like your lungs, as it can affect your oxygen levels. So common questions I get asked is, should you try to move as much as possible during flights? My answer is yes. It's generally a good idea to move as much as you can during a flight if it's safe for you to do so. Tips for staying active during a flight include walking around the cabin when the seatbelt sign is off. This helps to stretch your leg and encourage your blood circulation. Whilst you're seated, here are some exercises you can do, and these can also help with blood circulation and reduce your chance of getting a blood clot. If you're at an increased risk of a DVT or an embolism, your doctor might suggest compression stockings. The most important tip, you need the correct size for it to work. If it's too loose or too tight, it won't do its job properly. So my top tip is to make sure you get measured appropriately if you do need compression stockings. Another common effect of flying is dehydration. So how do we stay hydrated on a flight? Well, an aircraft's air filtration system is to blame. This takes outside air from outside and puts it into the cabin so we can have clean air circulating. But doing this makes the humidity drop to a 10-20% level, and it's usually between 30 and 65, which is comfortable for most people. Whilst this creates a clean environment, it makes the air humidity levels drop to 10 to 20%, and usually we find it's around 30 to 65%, which is comfortable for most people. Low humidity also means that moisture evaporates from your body quickly, which can lead to dehydration. So my top tips include, I always bring an empty water bottle with me and I fill it up in the airport. Usually you can find a free place to do this if you don't want to keep buying water bottles. Another tip is to avoid excess caffeine or avoid alcohol, which can further dehydrate you. Third tip is to include fruits and vegetables which have large amounts of water in them while you're flying. Another implication of travel is often dry skin. I don't know about you, but I often get dry, itchy skin, especially when I'm flying. This is because the low humidity in an airplane can help dry out your skin. Jet lag. Because of its relationship to sleeping and waking, you may have heard of taking oral melatonin to help treat jet lag. Jet lag is a temporary condition that occurs when you move through multiple time zones, such as flying cross-country. Melatonin is a drug that has a short-term hypnotic effects, and for some people, it can improve jet lag symptoms. It does not change the circadian rhythm, but it does have a hypnotic effect in some people. In some countries, you can buy melatonin over the counter. Some people prefer to get their body ready for the time zone they're going to be going to by adjusting their sleep routine. Another tip is to adjust to your local schedule. Make sure you try to eat, sleep when locals would to help your body adapt faster. This is the tip that I find works best for me. I try to quickly move my routine into what the locals are doing and what the local time is, so I avoid jet lag for too long. If you're really tired and you have to nap in the day, take a short nap, usually around 20 to 30 minutes, to give you temporary relief until you can go to bed at the usual time in the local country. Expose yourself to natural light. Sunlight is a powerful cue for regulating your circadian rhythm. So open your windows and get natural light so you adapt fast. So make sure you're resting when your body is telling you to, and try to be patient while you adjust to your new time zone. And lastly, I'm going to end this video with my top tips for flying. I started flying when I was 5 with my family and have taken multiple flights a year since then. This means I've taken hundreds of flights, and these are my tips for you. I have multiple pockets I can put things in, and I always have the same pockets available for the same thing. So my passport always goes in the front pocket of my t-shirt so I can access it really easily and know where it is at all times. Do regular movement on a flight to avoid getting too stiff. I'm constantly moving my feet, my ankles, and allowing my circulation to be as good as it can be, especially during a long haul flight. I always make sure I have my water bottle and I refill it at every free station to make sure I'm constantly well hydrated. I also travel with healthy snacks like nuts, fruits, veggies to make sure I have access to healthy food when I'm traveling. If you're landing after a long haul flight and you still have to travel, I always have a change of clothes with me and a toothbrush. Basic things like this can help you feel fresh if you've been flying for a long time. Another packing tip is I always travel with my thickest layers, my thickest jumper and my thickest jacket to make sure I have room for packing other things in my suitcase. And lastly, I always have a pouch where I travel with a few small things I can hang behind the seat, and this is where I can keep some essential items. Thank you for watching, and I hope you found it useful.